So Infliximab sub-Q is not yet available in the United States, but should be available this year. And it's obviously generating a certain amount of excitement. However, one of the things that's true about the trough concentrations that are seen with subcutaneous Infliximab is that they tend to be at 20, which is considerably higher than what's actually usually something people are looking for. And patients can actually have myalgia and other adverse events associated with these high circulating trough concentrations. So if, for example, we take a patient who weighs 70 kilos and their dose is the 120 milligram pen dose, and they're dosed every 2 weeks, and their trough is actually 20, which is a common trough for the subcutaneous formulation, and we'd like to bring it down to 10 in order to reduce the myalgia that this patient is feeling. We can find the dose, and we can see, again, this is an individualized nomogram, but you can see that the days to target for both different pen strengths are considerably longer than 2 weeks. Now, this has a benefit in that it will save money. The subcutaneous form of Infliximab will be considered in the United States as an originator. It's not a biosimilar. And for the different pen strengths, you can have quite a long dosing interval. So depending on how you think the patient will manage these longer dosing intervals, you can pick the pen strength that gives you a dosing interval that you feel is most appropriate for the patient that you're dealing with. Yes, so again, even though the patients may generally have fairly high trough concentrations with subcutaneous Infliximab, that is not always the case. So if we go to a patient who weighs 90 kilograms, they would be taking the 240 milligram pen. And of course, the dosing interval is every 2 weeks. But if their trough concentration is relatively low, so we take it, for example, as 7, and we'd like to bring it up to 10, we can then also find, again, a different dosing interval for this patient that will work. So just like you saw with the IV, you can have different dosing intervals with the different pen strengths. And again, you would pick the dosing interval that would be most appropriate for this patient.